Welcome back, everybody, to another episode of the Psych Guys podcast.
The Psych Guys.
I'm Dr. Chun, here with my co-host, Dr. Logan Noone, and we are both resident psychiatrists.
Do you say resident psychiatrist?
Yeah, I think that has a nice ring to it.
You don't say psychiatry residents?
Nah.
Man, we have some therapy to do on you, brother.
Why? What's wrong with resident psychiatrist? Because I want to call myself a psychiatrist, and that's the only way that I can phrase it where I can use that word.
Yeah, I mean, I guess so. I've just always heard like a surgery resident, internal med resident, family med resident, psychiatry resident.
I'm a maverick. We'll just put it that way. I'm a weirdo maverick.
Yeah.
Anyway, welcome back, everybody. Today we're talking about bullying in medicine.
Bullying in medicine. Yeah, it's very much prevalent. And of course, medicine, also nursing, there's a lot of nursing kind of like it seems like harassment. It's just like sort of built in the culture of healthcare, unfortunately, and how it always seems like every generation says like, oh, well, I had it harder than you, so that's why I'm treating you maybe this way. It's like this weird, horrible culture that I really want to do this episode today because it's bullshit, man. And I really want to change it and make healthcare more of a fun learning environment.
Let me throw out one stat before I pass it back to you, Logan.
Okay.
Here we go. So in 1990, JAMA did a study which looked at this, and they found that 46.4% of students at one medical school had been abused at some point during medical school. And by the time they were seniors, that number was up to 80.6%.
Right.
That's a lot. That's like almost everybody.
Right. And it's like, but what does abuse even mean, I guess, in that?
Subjective, I
right.
guess.
And it's it's like the boomer in me is saying, well, what, are those softies just more sensitive than before? But it's like, no, I think there are legitimate concerns here in bullying. And it's, I look at it in the healthcare field, don't we want to attract our brightest students? Like we want to offer the best healthcare because, I mean, in my eyes, I think that should be one of our most important goals of the society. It's like, so we want to create this culture of it's like a good place to be, right? And so this culture of bullying is really just so odd to me, and it seems almost such normal place, especially I think at certain aspects of medicine compared to others.
What do you mean certain aspects of medicine compared to others? Are you talking about specific specialties?
Yes, sir.
That people may have possibly a perception that it may be a little bit more toxic than some of the other ones?
Right. So I got the impetus for making this episode based on my interaction with one of my medical students who made a comment about how, I'm going to enter into a surgery residency program. Hopefully I get to match into one. And, I'm just accepting that I'm going to be abused for 5 years. Ha ha ha. And it's like, this person was making a joke, but in some ways, like, serious too. Like surgery programs, thankfully as psych residents, we work hard. We definitely do. But I have a lot of friends in various surgery residencies, and they're all working 80 hours a week. The ACGME says we're not supposed to work more than 80 hours a week, but it seems like they do.
Okay, so the caveat there is that I read into this because I also found out there are certain weeks as a psych resident, I was also passing 80 hours a week.
Right, it's on average.
It's on average for the month. So, man, that's how they get you.
That's how they get you. It's all in the fine print, man. But I think it's safe to make a generalization that there is more of an acceptance of working insane, crazy long hours in the surgery specialties. So that's not, general surgery, orthopedic surgery, OBGYN. They certainly work a lot of those residents, and there's a surgery component to that, of course. It seems like urologists maybe work a little less than maybe some of the other, but I don't really know. I mean, I'm so far removed from the operating room, but it's not that other areas of medicine don't have abuse, but it seems like a lot of those surgery subspecialties are really toxic in nature.
Yeah, so I think you're alluding to the fact that you can not only be bullied by your colleagues, possibly your bosses, but also by the system in terms of the hours that you work. So here, quick story for you. I remember during intern year, I was on call. I was doing medicine call with the orthopedic surgery resident, and he was telling me that he has to wake up at 3:30 in the morning so he can get to the hospital by 4:30. And he's like, "Oh, I can't wait till next year because next year when I'm a second year, I get to wake up at 4:30 and show up to the hospital by 5:30." And he's just like, "Hell yeah, I can't wait."
Dude.
And there's me sitting there, and I'm just like, oh my god, even like 8 o'clock is like early.
Dude, and it doesn't make sense to me because it's like, why in a world where these people are dealing with the sharp objects would we want them sleep deprived? You know,
Exactly.
sleep deprivation is essentially equivalent in some ways to like a blood alcohol level, like being
Oh,
intoxicated.
absolutely. Yeah, it
And
absolutely is.
it makes no sense to me. And I mean, what is your feeling around kind of the acceptance of abuse in medicine and nursing?
Before we go there, let me make one other point about these long work hours and that potentially being, possibly bullying/abuse. Do you know the history of how residency programs were designed?
I mean, I don't know the specific history, but I know that it was designed, or the person who got it off the ground was like heavily addicted to meth, right, or cocaine.
It was cocaine, man. He was,
Yeah.
yeah. So it was a Dr. William Halstead. He's
Yeah.
actually one of the pioneers of modern day surgery. Really accomplished individual.
Mhm.
Invented various new surgical techniques,
He was great.
including radical mastectomy. So
Okay.
techniques that are still widely in use today.
Mhm.
And as part of his pioneering characteristic, he was also experimenting with new anesthetic drugs, one of them being cocaine.
Mhm.
And he happened to get addicted to cocaine, and he was just notable for being able to work these extremely long and grueling hours.
Mhm.
And he kind of modeled the residency program after that, and they were called residents because they were basically residents of the hospital. That's
Mhm.
how much time they spent in the hospital. And his residents were expected to keep up with the pace and the long hours that Dr. Halstead was working.
Yeah.
But I don't think any of the residents were on cocaine. So Dr. Halstead had an unfair
Yeah.
advantage, and that's kind of the system that was implemented, used as a model to be implemented to modern day training programs. So here we are working these long hours.
Yeah, and it just doesn't really make sense, right? Because, residents still generate revenue for the hospital. At the end of the day, we're paid a wage that's much less than the profit margin that we're bringing in. And that's most apparent even in the surgery subspecialties. Because it's, a lot of our healthcare is procedural driven. What never makes sense to me is, one, why is this abuse still so well accepted that we work so many hours? But it's not even just about the hours, right? It's sometimes how the interpersonal interactions, how attendings can get away speaking to their residents, how residents can get away speaking to their medical students. And I think the same thing can be applied to our nursing colleagues too, how the senior nurses or the nurse manager, essentially you always hear the term like kind of treat their young or like bite their young.
Hmm. Probably, if I had to take a guess, I mean, this is my personal evaluation of the situation. I bet it probably has to do with the fact that, one, of course, this is the phase of delayed gratification. We always have that hope, like, hey, I'm
Mhm.
going to put up with this BS. Today's a tough day. Tomorrow's going to be a tough day, but eventually it'll be better. I'll finish residency and I'll have all the leverage to do whatever the hell I want.
Mhm.
So, in one aspect, that keeps us going. And the other aspect of it is we really have no other options. I mean, it's incredible. In 2023, no other profession you can put this much education into yourself, dedicate this many hours in the workplace, yet have so little leverage.
Yeah.
If you can't leave your residency program, it doesn't, like, if they tell you to work 80, 90 hours a week, it'd be more difficult to find a new program rather than to just, tough it out and get through the program that you're in right now.
Mhm.
And you have to remember that many of us come from families that can't pay for this extremely expensive medical education that it costs like hundreds of thousands of dollars. So
Mhm.
by the time you're in residency, you're really committed, and you have no other options. Your loans are incurring interest on a daily basis. Well, not right now because of
Yeah.
the
Thanks,
freeze on
COVID.
student loans.
Yeah.
Yeah. But under normal circumstances, we would be going further and further into debt every single day. And the only hope to salvage the situation would be to get through our training programs and come out on the other side. And I think we see the people that's made it out, and sometimes these are the people that are abusing us. And in maybe a sadistic way, we kind of see that and say, hey, like I'm getting effed over right now, but maybe one day I'll be on the other end and I won't have to put up with any BS from anybody.
Mhm.
So maybe that's what keeps us going.
It's almost like this weird multi-generational trauma. It just like keeps on getting passed on. Like, well, I had to go through this adversity, so I'm going to make it hard for you. And that being said, it's not all attendings are bullies, right? But some residents can be bullies to their subordinates. I think we have to kind of acknowledge that some adversity is good, right? Some adversity we both have faced as residents. Like, it helps you grow, it helps you become a higher skilled physician,
Absolutely.
better confidence at the end of the day. I think where we have to advocate to draw the line is when it becomes unprofessional conduct. Interpersonal skills that would not be accepted in other workplaces. Talking down to one another or calling each other's really kind of vulgar names or something like that. Unfortunately, I have experienced, stuff like that. It's not cool. Have you?
Yes, I have. I mean, the statistic is that 80% of medical students by the end of their 4 years experience it. I've experienced it as a student. I've also experienced it as a resident. Actually, the time as a resident, it was from another resident who was, a year ahead of me running the service I was rotating on, and I just had a terrible time. Logan, I think just being in that kind of environment, just knowing what you're walking into day in, day out, it does a lot for your morale. I mean, my morale was down in the gutters.
Right.
I did not feel good about going to the service in the morning. And, I hate to say, but there was even a few days where I just called out sick. I mean, I
Yeah.
wasn't sick. I was
Well,
just like,
I would say you were mentally healthless.
yeah,
Or
yeah. I was
mental-
terrified. I was so terrified of going. I remember there was one night I literally could not sleep.
Wow.
And at like 3 a.m., I just sent an email and said, "Hey, I'm not feeling well. I can't come in."
Mhm.
But me feeling not well was just me staying up till 3 in the morning, just dreading having to go see this individual the next day.
Wow.
And I was
that's
just like, man,
powerful.
I just can't do it. I just hate being around you. I hate everything about you. Just leave me the hell alone. I'm ready to move on. I don't care if I get a bad grade on this rotation.
Right.
I just want it to be over and like never have to deal with you again. Fortunately, that was an exception. Most of the residents I've worked with are,
Right.
yeah, they've been pleasant. They're lovely people. But yeah, there's been times where, it seems like that person is going through a really tough time.
Yeah.
They're hating their own situation, possibly because of how grueling residency can be.
Right.
So I hate to fault an individual. I'm just gonna chalk it up to the system that they're in. Everybody's frustrated. Everybody's in this pressure cooker, and there's certain stretches where you just crack, and sometimes that spills over to your team members, and it can cause a very unpleasant team environment. And what I worry, at the end of the day, is that kind of culture can lead to harmful outcomes for patients we take care of.
Right. Right. It sounds like you're kind of trying to institute. Are you familiar with is it Don Miguel Ruiz, The Four Tenets of Life or The Four Principles of Life? You ever heard that?
Nope.
We'll do a whole podcast on that book. I love that book. But one of the ones is don't take anything personal. Like you were saying, it's like, that if you are being in that situation, it probably has nothing to do with you. It probably, that person maybe does have a lot going on in their life that you don't potentially even know about. But that being said, I also think you shouldn't just take it. We need to try to create this kind of environment that can change medicine culture. And so I do think, I've faced similar situations where I've thought a person is being highly unprofessional in nature. And I think it's also extremely important that if you are in those situations, that you do have the bravery, is that the word I want to use, or the ability to stick up for yourself. Because I think that if you find yourself in that situation, realize that someone in the future, someone ahead of you, likely could be in a very similar situation, if not even worse. And so if you don't stick up for yourself, you're not protecting that next person in line. And isn't that what we're here essentially as physicians to do, to try to, improve the world, heal others around us? So I think it's important to be willing to take that step and be a whistleblower, right? I like to think that these administrators, as much as we make jokes about how, their job is kind of maybe not always needed, right? Or whatever. But, I think administrators at the end of the day are good in nature too, right? Like, they want to hear about the ways that the system is not working in an optimal fashion. And the best way to institute change is by being willing to be one of those whistleblowers. And I think if you are a whistleblower, also realizing that when you do file a complaint, maybe sleeping on that email before you write it when you're really all hot and emotional. When I was in this particular situation, I remember I took an entire weekend, to formulate how I was going to compose writing this complaint, because I wanted to sound professional in nature. And I think that's kind of the key word there. It's that if you're going to combat unprofessional conduct, you need to hold yourself to that much more professionalism. Like, two people in a shouting match are both going to look like complete idiots. But I think remaining calm, professional, stating the facts of the situation and saying, hey, this person made me feel this type of way because of their, in my opinion, unprofessional conduct, and I think that this needs to be mitigated against. Thankfully in my situation, I was able to get a positive outcome that did yield to some change, something that I'm really excited about. But why I really wanted to sit down and have this conversation with you today is really to try to inspire people who are in situations like we were in to try to stand up for themselves, but in a professional manner.
I think bravery is the correct term there. Possibly even courage, because it is a fact that in medicine, there's a very hierarchical culture, right? You are a resident. You are, there's the med student at the bottom. There's the resident, the first year resident above that, second year, third year, fourth year, so on and so forth. And then there's that attending who, like, sometimes they seem like gods to you, how powerful they are and how much control they have over your professional career.
Right.
And there can be this element of fear of speaking up and standing up against somebody that's, that's already an independent practicing physician. So yes, I think courage is the appropriate word, because it does take a lot of courage to say, hey, this person is in a position of authority over me, yet because I care about the people coming after me, I'm going to take this step and try to make a change, because you didn't have to do that, because our time on the rotations are limited. I mean, I've certainly had rotations where I thought something was wrong, but I mean, maybe it was the wrong approach, but I just kind of put my head down, like many of us do. I just put my head down, did my work, grinded. If I got yelled at, I was just like, whatever, brush it off. This person's just cranky all the time and has nothing to do with me. And I'm just going to move on, be done with the rotation, move on and not think about it anymore. So I think many of us go through rotations where we should say something, but because either how busy we are, or maybe we just don't want to deal with the extra burden of having to go through filing a formal complaint.
Right.
Because that process can be daunting as well. And during the course of a tough rotation, like honestly, all you're thinking about is just, hey, what day is it? How many days do I have left? Yeah, let me cross another day off the calendar and keep it moving.
Yeah. So, I think handling individual situations of, abuse, unprofessional conduct, it is so important to try to stand up for yourself. And I think you highlighted on some of the reasons why people hold back, right? But I hope that people realize that, by standing up for yourself, you're also protecting people in front of you too. So I really hope that people feel somewhat inspired. I was able to get a positive outcome. I know some people have filed complaints and not gotten any change, and I imagine that's very frustrating. I've had colleagues who have experienced that, firsthand, unfortunately. So that's, I think, the best way to handle individual episodes of kind of abuse, bullying, like we're talking about. But what about if we try to take a step back for an entire systemic cultural change in medicine and in nursing? How do you think something like that could change?
Well, like you alluded to earlier, the culture of medicine is that the people that came before us, their mentality is, I went through a tougher system than you. And in many ways, they did. We have to acknowledge that there was, as we joked about the 80-hour work week rule earlier this episode, but in reality, when many of our the previous generation was going through their training programs, that wasn't even around.
Crazy.
And they were subjected to worse hours than us. So, there is some legitimacy there that they did go through a tougher system than us.
Right.
But at the same time, that's what perpetuates the cycle of bullying in medicine, right? That leads to up to 80% of students saying that they felt like they got bullied during their medical career. As a student. So I think the onus is on the individual. Like we have to be able to recognize it, and we have to just say like that generation trauma we talked about, right?
Yeah.
One generation has to step up and say, hey, it ends with me. I got beat. I'm not beating my kids. It ends with me.
Right.
And I'm changing my family tree. So perhaps and possibly the only legitimate solution is, the younger generation of physicians coming up. We have to take an approach of respect, camaraderie, and just overall caring and looking out for one another, because at the end of the day, we're all on the same team. We're all here to try to make a difference in patients' lives, and it's tough. It gets tough. Residency, there's certain stretches where you feel like garbage because
Right.
of how stressful everything is, and we have to encourage a supportive environment rather than one where we pick on the weaknesses of other and we look to put other people down.
Right. Right. I think like the really true way to fix this systemic problem, as I think with systemic solutions, the only way that we can actively change things, especially like as residents, there needs to be, in my opinion, like a large resident union, really a federalized resident union, and maybe even a medical student resident union, a federal nursing union. Say what you will about unions. I know they're not perfect, right? There's a lot of area for improvements here, but at least it would give residents and medical students a seat at the table to have the discussion like, hey, what is a pay that we would actually be willing to work at? What is a work environment that we think would foster the greatest type of learning environment? Because we do bring not only revenue productivity to this team, but also innovative solutions to this team. We're young adults, young professionals in this environment. Like we do contribute, and I think that's really the best way that we could actually implement some necessary changes to this system, that would, cause improvements to the bullying situation.
Right. As residents feeling like we're underpaid, underappreciated. I mean, that's got to be I'm going to say a near universal experience for all residents, because, I mean, even as a psychiatrist, going through my residency program, there have certainly been times where I felt very frustrated by the system.
Right.
And I wouldn't necessarily consider that bullying or abuse, but I guess in a sense it is just the way the system is designed.
Systemic bullying.
Systemic bullying, which by default says that I'm not blaming any individual specifically, because I don't fault the other professionals, like especially when we have like NPs, PAs, that have, that are a lot of the times, even sometimes younger than me, they have much less training, but as a resident, their wishes and needs take priority over mine, and we can be both on call together, and I'm there because I was just kind of told by my program, you have to go here and do this, and I see other people that are there with less training than I have, and they're getting paid like time and a half to be there, and it's just very, very deflating. So it's a tough situation, but like I said earlier, like I know at the end of the day, after I finish training, I'm gonna have the skills that not a lot of other people are gonna have, and a lot of that comes from the long hours that we work, the experience that we've had, the cases that we've been involved with. So perhaps as unpleasant as it is, I do recognize the benefits of working those kind of hours and just being involved in complex cases. But at the same time, there's definitely frustrations, especially in terms of, the pay. And because ultimately that translates into feeling underappreciated, right? You feel like you've put in all this work to try to get into med school, get through med school. Now you're grinding through residency, but it seems like the hospital is saying like, we don't really care about you that much right now.
Well, I just think a lot about like, I don't really understand why we need to have these silos of necessarily physicians, residents, PAs, NPs. And in reality, if they're kind of doing similar tasks, I look at it like, look, if you can pass this test, if you go through this particular set of schooling, like why are we taking these USMLE exams and then the NP takes the NCOMLEX or the NPLEX or whatever, right? I don't know what the PA thing is called, but what if there was just a universal exam that every level up is a higher level of complexity. And if you're able to achieve that higher level of complexity, you're able to then be entitled to to offer that level of treatment care, then you have to go through whatever necessary, trainings, number of hours. So there just kind of was a more universal ladder that was better understood through the whole system. Does that
So
make sense?
yes. So then the question would be, is medical school even necessary?
So
And I think we can do a whole episode on that.
right. And I I think that there should be elements of medical school and nursing school and vice versa. I just think, why can't there be a more universal kind of training model that as you kind of train your way up this ladder, instead of taking on fucking absorbent amount of debt, you just work your way up the system, almost like an intern or apprenticeship at like an electrician kind of company.
It's a wacky system that we have right
Mhm.
now. It's a wacky system. Certainly it's far from perfect, but I guess it's the only system that we have. And
Right.
as we know, systemic change is painfully slow. So at least for the moment, we're here. We're in the trenches.
We're in the thick of it, but I think we've kind of rambled, of course, like we always do in many of these podcasts. But I think if you're experiencing what you feel is bullying, abuse in your healthcare situation, whether that's a medical student, a resident, maybe even attending getting abused by their administration above them, there's probably even a culture of bullying there too, right? Or nurses, MAs, really whoever. I think you have to be willing to stick up for yourself and be, in a sense, like a whistleblower. But if you're going to be a whistleblower, do it in a very professional manner. Sleep on it. Have your significant other take a look at that formal complaint before you fire it off to administration or whoever. There are certain channels that you can make anonymous complaints, or you can do it not anonymously. But I think it's doing it so in a professional manner, and sleeping on it is my best attitude. And
Right.
best
Make sure
advice.
it's not driven by emotions.
Right.
Sleep on it, think through it logically, and if it still warrants that type of response, certainly, I would even go far as to say the responsibility is on you to take that action, to contribute to bettering the system that we have right now. And with that said, do you have any stories? Do you feel comfortable sharing any stories?
Yeah, I mean, it's there was the situation where I had this attending who was, I thought very unprofessional, calling me names, trying to put me down in front of other
What kind of names?
dumbass,
Oh my goodness.
incompetent. You need to be much further ahead of where you are. And I look, some of those criticisms might have been even fair. I'm not here to say that I'm the strongest medicine resident. Of course not. I'm a psychiatry resident. But I think it comes down to professionalism. How the message was delivered, I think, was in such egregious unprofessional nature that it motivated, as similar to you. I had days where I didn't want to go into work. It was in the worst work environment I've really been a part of. And this individual had kind of a reputation amongst this entire hospital for being like that. And I know I wasn't the first person to complain. But I remember coming home to my wife and discussing my really horrific experiences and how it wasn't a good learning experience for me. It was just a waste of time, how I kind of thought of it. But I remember sitting down and talking to some administrators that I really did respect. And they encouraged me, hey, look, if you really feel strongly about this and want there to be a change, you have to be someone that's willing to take a stand and willing to be a whistleblower and say, like, no, that this is not okay. And I remember, like I said kind of earlier, I took my time writing this complaint. I figured out how I could say it without being in myself too emotional or unprofessional in nature. I wanted to be the utmost professional when I made this complaint, because it's going to be better well received. And so I think that's really, if you find yourself in that situation, I encourage you to do the same thing. Be willing to stand up, because that person, after this complaint, there was some changes, and I don't want to go into the specifics. I think that's unfair to even that person, because that person who was, I would argue my abuser, right? I imagine they were going through some own shit in their own personal life. Like I tried to not take it too personally, but I think it's important to try to improve the learning environment for all of my colleagues.
Right. those kind of actions, like you said, always reflect more on the individual that's
Mhm.
perpetuating those actions rather than the one that's receiving it.
Right.
And yeah, I'm sorry you had to go through that, Logan, but sounds like you were able to make a positive change
Mhm.
because you were willing to stand up and speak up for your colleagues. So
Right.
we all appreciate you for that. I can tell one last story and we can kind of wrap things up. I remember when I was a medical student, this was during the height of the COVID pandemic, and I was working in the ED, and I was we got a call through the radio that they're bringing in a person in respiratory failure. I think it was like an older lady. But basically, she was desatting. We had to intubate her.
Mhm.
So me and the attending ED physician, he tells me I'm coming in on this case. So we gown up. We have all our PPE on, and we have our masks on. We have the shields. And I remember it was just like very hard to hear because of how muffled you sound when you're wearing those N95 masks.
Right.
And especially with the chaos of somebody being brought into the ED, they're desatting, turning blue in front of you,
Mhm.
and you have to get a tube down their throat to help them breathe. It was just a chaotic environment. And long story short, I was successfully able to help with the intubation. And after we do intubation, of course, you need to bring in a portable chest X-ray, get the imaging, make sure that tube is in the right place. And we got the image taken, and I swear it sounded like the doctor was yelling at me like to get Bridget, to get the nurse. I think the nurse's name was Brenda, and my colleague's name was Bridget.
Uh-huh.
So it was very hard to differentiate. But basically, I couldn't hear what name he was saying, and I thought he was asking the nurse to look over that X-ray. So I was like, hey, I poked my head out the room, and I was like, hey, like he's asking you to read this X-ray, like is it in the right place? And man, he just like flipped out
Ripped
on me.
into
He's
you.
like, yeah, you nurses can't read X-rays. That has to be done by a physician. Like, what are you doing? Get the F out of the room.
Oh.
And yeah, I just kind of left. I was like very overwhelmed. We actually had to like have a long one-to-one after that, and I was just like, hey, like, look, I couldn't freaking hear you through that mask.
Right.
And I mean, honestly, like I love that rotation. I
Mhm.
really love that guy. He like put a lot of trust in me, let me do a lot. So I always appreciated that.
Right.
But in that moment, yeah, it was a little bit jarring that he got like that frustrated.
Right.
But I guess in an emergent situation, and you never know what somebody's
Tempers
going
fly.
through.
Yeah.
And we can kind of wrap this up by saying that there's some colorful personalities in medicine.
Yeah, the stressful situations bring out, arguably the worst in us, right? But I feel like oftentimes in those stressful situations, at least in medicine, it doesn't seem like there's like a good powwow after, right? Where it's like, hey, let's talk about it. Like if there was a psychiatrist on every single team, maybe we'd all like, sing Kumbaya a little
Hey,
bit.
let's sit in a circle and
Let's talk about our feelings for a second. But I think maybe that's actually one of the best changes. We mentioned residency unions and all this other stuff, but like just acknowledging that there is such an emotional experience of working in medicine, because we do see some really horrible things at times, and we're dealing with high stress situations where just tempers fly, and I think if we had more just kind of like time built into our schedule to have experiences like that, I think it could be much better work environment. But it's nope. On to the next one. Let's go see the next patient. There's not even any time to have a breath.
It's an imperfect system filled with imperfect individuals.
There we go.
Hang in there, Logan. Keep grinding.
Cheers. All right. This was a tough episode, but thank you for listening to all 30 something minutes. Leave a review. Send this podcast to a friend of yours who you think would appreciate it. Thanks
And
for
we'll
tuning in.
see you in the next one.
All right. Cheers.